Edo Broadcasting.
All right, welcome back to the studio. This morning we have a wonderful woman, a philanthropist, an activist, if I put it that way, an advocate, someone who is advocating for better life for her people. She is the president, the founder, and the CEO of AMNI Healthcare and Empowerment Foundation. She is Rita AMNI Oguntoyibo. Good morning, madam.
Thank you very much.
Nice
Good morning. Thank you.
Now, when I looked through your card, I discovered that you are into medical healthcare. So what is AMNI Healthcare and Empowerment Foundation all about?
Well, AMNI Healthcare and Empowerment Foundation was founded in 2004, precisely when I clocked 20 years in the service of WHO, when I came to the realization that each and every one of us has a role to play in providing healthcare delivery, in reducing morbidity and mortality. And I felt that even though I was resident in Lagos and I had been born and brought up there, my immediate reaction was to come back home to Edo State to provide healthcare services to the people. And AMNI Foundation is named after my mother, Amena Anwo, and I started with her community and the two adjacent communities, Isiho, Ewomori, and Iheja. This is how AMNI Foundation started.
Now, you've worked with the World Health Organization. How was working with that big entity?
Very enlightening and very inspiring. And I would say that my outlook to life has been shaped by my exposure, the exposure I had working with such an organization, and my decision to have a health foundation, even though I'm not a doctor, I'm an administrator by training and work. But I found out that there's a big gap following documentations that I had the opportunity of reading, and I saw that we can really do a lot, well, not too much, to reduce the level of deaths that we are recording. And it doesn't really take too much, not the way people look at it. You don't need a billion to provide good health for the people. Basically, my understanding and realization is that people need a lot of awareness. People need to know what to look out for. We are very interested in letting people know that there is a need for them to go for general medical checkup, even when they are well, because a stitch in time saves 9. When people walk into hospital to say, I want to know my vitals, I want to know my health status, it enables them to know if they are hypertensive, even when the symptoms are not there yet. They are able to know early in time to take care of it. If people have cancer and you find it at the early stage, you can actually take care of it. And one of the things AMNI Foundation has been doing in this state and everywhere else around the country is that we are trying to get states to adopt a very simple and cheap method of preventing cervical cancer. And this procedure is called visual inspection with acetic acid and treatment with cryotherapy. And this was This was taken up by WHO, and they started pilot programs in 5 countries in Africa, and Nigeria happened to be one of them. It's a very simple procedure which enables you to see signs, the early signs of cervical cancer, just by the drop of acetic acid. And once you see the precancerous lesions, you can actually treat on the spot using the cryotherapy equipment. And this we have done with Edo State since 2008, and it's running seamlessly at the Specialist Hospital Family Planning, you know, in Edo State.
Okay, now AME Foundation, it's like 13 years now.
Yes.
How has it been? You know, have you, what are the constraints you've had working with your own people?
Well, I see, because I've worked in many states of the Federation, even though we started in Edo State. I think it's basically the same thing all over. When you come in for the first time, people are suspicious of you. Some people are difficult because they want to see what is in it for them. They expect you to give them something before they become cooperative. As I was saying, we collaborate with the Edo State government in 2008 to train 77 doctors and nurses drawn from all the LGAs of this state. And my idea at that time was that there should be a cancer screening center in every LGA. But I'm sad to tell you that very few centers are there. Very few people out of the 77 people were willing to work, because there wasn't anything robust to go with it. And the central hospital, where the specialist hospital where this program is running, I have had to support that center. I had to provide the first cryo equipment. I had to be paying for the consumables and supporting outreaches, and I still oversee that center to ensure that it is running. So the point I'm trying to make is that sustainability is a problem. We do not have the will to get things done and get it through. But I hope that with time we will begin to develop and improve on this.
Even with all these constraints, you are still motivated to the extent that you spend your own money and then you would organize free medical services. What motivates you? So I've seen a lot of NGOs that started and just folded up.
Yes, what motivated me in the first place is, like, I lost my father when I was just 16 years old. And in fact, the outreach we are going to have on the 8th and the 9th is to immortalize him.
Okay.
The foundation is named after my mother, but I'm starting from this year to immortalize my father with an annual outreach in Edo State. So we'll be moving. We're starting in Benin City. Next year we're going to go to another LGA. We'll go around the entire state. And what motivated me is that I lost my father at the age of 16. And my mother, you know, had to really struggle. We were 8 children. I was the second. I was just entering Form 3 in the secondary school. And I didn't know from the difference from my left and right, but the Lord saw me through, and I found myself, my first job was to work with the former president of the country, Dr. Nnamdi Azikiwe, and Chief Adeniro Ogunsanya at the NPP headquarters. And I was so much appreciated, and I was elevated far beyond my age. And then after that, I got the job with WHO, and I think I have had a very beautiful career. And when I clocked 20 years in WHO, I looked back. Everybody must look back to where you are coming from. And I said, this is God in my life. And I thought to myself, how do I show to God that I appreciate him? I thought of so many things. As a lady born in Lagos, brought up in Lagos, the first thing is to party. But again, God ministered to me that I should go back home and do something for those poor people who are dying from preventable and curable diseases. And so I set out by putting aside my own resources, because as a WHO staff, I couldn't go cap in hand soliciting for funds. So I had to put aside my own funds, spoke to a few of my siblings.
I was going to ask you about funding.
Yes. Spoke to a few of my siblings, and of course, because I was working in WHO then, I didn't leave my office. I sat there in my office. The first person I spoke with was my representative, to say, my country representative, to say, this is what I have in mind. And he said, wonderful. And then I discussed it with my colleagues, and a few government officials from the Ministry of Health, from NAFDAC, who visited me during that period. I mentioned it, and I got support. I got a lot of support from Dr. Dewe Awoshika, you know, through immunization, because I wanted to give people anti-tetanus. This is something a lot of our people do not know, that if they have a cut, especially the farmers and children who are playing all over, if they take anti-tetanus, it saves life. We also gave immunization. I also got a lot of support from Dr. Shufola, who was the head of the malaria program. She gave me nets. I got support from a few people, some colleagues. That was how AME Foundation started. And I was really excited when we had the first outreach, and I saw how people were, you know, how people benefited. That encouraged me. And then a lot of people came with eye issues, which I wasn't prepared for on that occasion. So by the next year, 2005, I invited doctors, ophthalmologists, optometrists to come and support. That was how the eye care started.
Now, you see, I'm inspired, and I want to believe that a lot of women, young ladies, will be inspired by your work. You know, you had every reason, you know, growing up, not to turn out this way, but with God on your side and with your determination, you are this way. You are now an inspiration to other women. Now, AME Healthcare and Empowerment Foundation, where are you taking it to?
Well, you know, when you start, I remember when I just started, a colleague of mine in WHO, then Professor Dunjiri, said to me, Rita, you know the beginning, but you cannot know the end. I cannot tell where it's going, but it is progressing. And just before I retired, in November 2015, I got a grant to support Gombe State to handle neglected tropical diseases. And we are in that state. We've been there since 2015, treating adults and children to prevent onchocerciasis, soil-transmitted ailments, lymphatic filariasis, and schistosomiasis. We've been doing that, and this October we're going to add on the eye care, and then we will go on to do the cancer prevention. That's in Gombe. Okay. But all these we are already doing in Edo State. And we have supported several other states. Of course, don't forget, I was born and brought up in Lagos. We have also had to support Lagos State. And we've been invited to several other states. And so I really don't know how far, but I know that the program is in the hands of God. We are sincere. We are not, we don't depend on grants. The only grant I have is for the NTD in Gombe. Everything I've done in Edo State in the last 13 years has not received any grant from any organization. It's been from my resources, supported by family and friends. And so I believe that once you set out to do something with sincerity, God will be in charge. So God is the one who will know where he's going to take AME Foundation. But let me assure you that AME Foundation will continue to support Edo State, because this is my state, and I desire to see the state grow and be helped, you know, and continue to reduce the number of mortality we are recording.
Well, I have been so impressed by most of the Edo people who have seen, who have been in diaspora, but decided to come home to use the knowledge they garnered to help their people, and you're one of them. So I want to thank you very much for having it in mind. You are married to, yes, you are married to a Yoruba man, you are a Lagosian, but you choose to, you know, come home and do something. Instead of having an Owambe party, you came home to do something here.
Yes.
Now, you have a program that's going on now.
Yes, we have a program starting tomorrow. Tomorrow, Friday the 8th, and Saturday the 9th. To immortalize my late father, the late Obama Hiaye of Benin Kingdom, who died 45 years ago. We're going to be doing free eye care. We'll be distributing glasses. We're going to sort out those who will need cataract surgeries. This program will be supported by the Teaching Hospital Benin. You remember, I have a collaboration with the Teaching Hospital, so they will come and provide the screening exercise. And then the centre is taking place at the specialist hospital, at the family planning, which is also the pioneer center for the prevention of cervical cancer. So we're going to be doing cervical cancer screening, and those who have precancerous cells will be treated.
Okay, so that means what you mentioned as a specialist, what the little person knows as the central hospital. So
yes.
The family planning
section, that's where we will be.
You're having it free?
Yes, it will be free, totally free. It's from 8 a.m. to 3 p.m. for the 2 days, tomorrow and day after. We invite the public to come and benefit.
Okay. All right, we've been talking with the founder, the president and CEO of Amen Healthcare and Empowerment Foundation, the lovely Mrs. Rita Amiwu Oguntoyibo. She is a daughter of the soil, and she has the free health medical outreach. She has free healthcare. If you have eye issues, she's doing something at the Central Hospital, the family planning section. So she's inviting everybody come and take advantage of this opportunity to get yourself screened for cervical cancer, to check your eyes, to get free eyeglasses. If there's cataract, she has, so graciously and generously said it would be treated, and it is absolutely free. I know people like free stuff. When you hear freebies, oh, everybody is going there. So you will have a
they're most welcome. They're most welcome. Yes.
Cope with
oh yes.
The influx.
Oh yes, we can cope.
And it's tomorrow and Saturday. She's having it tomorrow and Saturday from 8 a.m.
to 3 p.m.
At this Central Hospital, the family planning section. When you get to Central Hospital, you could ask the security guard that you're going to the family planning section. That is where the free medical outreach is taking place, as powered by Amen Healthcare and Empowerment Foundation. Mrs. Rita Amiwu Oguntoyibo. Her number is on the screen. I hope my wonderful Steve Obasunwan, please put her number on the screen so that anybody who wants to make inquiries, you want to reach her, you want to support her work, because she can't do it alone. She's not asking, she's not going cap in hand asking for help, but then you could support this wonderful woman. If I had the millions, I would so graciously support her, because what she's doing is touching the lives of people. Her number is on the screen: 080-3300-5886, 080-3300-5886. Thank you so much.
Thank you for having me. Thank you.
I hope we'll have more time to interact.
I hope so too. I'll be delighted. Thank you.
You could visit our Facebook page if you have a question for her. It's Daybreak Thursday on EBS. Go to our Facebook page, drop a comment or a suggestion, or just an appreciation for this wonderful woman. Daybreak continues shortly. Don't worry.